Hello, my wellbeing buddies. It's Steve, your mental health nurse, and I've been asked to do this session on COVID and mental health. Now, we obviously all know what COVID is, and ultimately we're on the back end of kind of its wrath, shall I say. So the COVID-19 pandemic clearly had a significant impact on mental health worldwide. So it's a global problem. And the pandemic really caused a range of stresses and challenges. And one of the biggest stresses it created was social isolation. We'll get that out. And social isolation can be a real problem because it can cause depression, anxiety, substance misuse, trauma, and all of that stuff, and everything just comes off the back of that. Equally, it caused social issues. So it caused things such as housing problems, work problems, financial problems. So it's had a real negative impact on mental health. So I want us just to think about some of the things that's happened, some of the things we can do to help. So first of all, there has been an international increase in anxiety and anxiety and depression due to the pandemic. And that's because it increased the anxiety and depression due to social isolation, financial stresses, and concerns about the future. Then there was an increase in substance misuse. So this led to an increase of drugs and alcohol misuse. And this was around self-medicating as a coping skill to those stressors and those challenges. Sadly, there was an increase of domestic violence and safeguarding, and that was because people were spending more time together, causing a further problem. It had an increased risk of suicide and self-harming behaviour because, again, uncertainty around jobs and experiencing that stigma and judgment. And finally, some issues around PTSD, because people, especially healthcare workers and other people, were exposed to quite difficult and challenging scenes. And I can say that from first-hand experience because I was out there on the front line with my staff when this first happened. So what can we do about it? Well, first of all, let's just look at our mental health piece. Really, we need to look at the skills and the techniques and the strategies depending on what this might be. So if we've got a piece around the anxiety and depression, so for anxiety, we want to have a look at what particular part of the anxiety it is. Do we now have health-related fears? Have we got social anxiety? Have we got panic attacks going on? So if we know the fear and the type of anxiety, we can put a plan together to manage that. If it's depression, let's get that assessed. Let's look at what level you're at. And that might then involve serotonin inhibitor uptakes and or cognitive behavior therapy. If it was about stresses around financial and stuff like that, let's look at social prescribing. Let's look at support groups and charities to get people back on their feet. So that might be turned to us as a charity, Citizens Advice Bureau, having your benefits reviewed. It might be the case of looking at your local authority, getting a Care Act assessment and all of that stuff there. If, however, you had substance misuse going on through there, let's do a referral to our local substance misuse services. Let's look at our IAP services as well, and let's look at how we can have a reduction there. The domestic violence, there's lots of domestic violence line numbers out there. Talking to people, getting yourself back to a secure and steady place is going to be paramount. And again, having those networks and opportunities to talk, and I will put this all in the links below. And again, that risk of suicide, so please watch that risk of self-harm and suicidal behaviour. And again, for PTSD, watch my PTSD video. So all of these we can pretty much manage. The other problem that we've got off the back of this is this constant fatigue and this breathlessness problem. Now, the Opera Society did a wonderful piece of work and they did Zoom groups, and through opera and through singing, people were being able to retrain their lung capacity muscles and to work more effectively. And again, I'm going to put in a link below, a link to that program. And there are some exercises you can do online to strengthen your respiratory lungs and try and clear some of that stuff. So breathing exercises is absolutely paramount to that. If you've got that fatigue piece off the back of it, then we need to look at supplements and sleep hygiene, and we need to look at ways of how to manage that piece of fatigue. There are the long COVID clinics that you can be referred to, so please make sure you go and speak to your doctor and ask for a referral to the long COVID clinic if you think this is a fallout off the back of that. But ultimately, what I want to say here is it's important for you to address your mental health impacts of COVID-19 pandemic. Seek that help, get the support for experiencing the symptoms off the back of this. So the symptoms might be anxiety, depression, and that's CB, cognitive, post-traumatic stress bit. Make sure, in addition to all of that, you are self-caring. So you're exercising, eating well, sleeping well, and improving your mental health and well-being. And for those that may still be self-isolating due to this social deprivation piece, please look at the charities out there and other organisations such as Age Concern or Shout or the Samaritans or any of those groups of people that you can talk to help feel listened and heard. And again, we'll pop some of those informations below. I hope that gives you some advice around how to manage COVID and your mental health, and I wish you all the best of luck. My name's Steve. I'm the mental health nurse. Please subscribe below. Take care.